Christina Stella, NET. It's clear the governor is in regular contact with the various meat packers about their mitigation plans. Have workers been present, any of them, or only management? So the conversations we've had primarily have been with management, again, about working on best practices, though we have received feedback from folks in our public health districts about what they're hearing from the workers on the front line. I've also spoken with Eric Reeder, who's the president of the UFCW, Local 293. On Friday, he shared with me some of their best and worst practices they've seen in the industry. I actually will admit I haven't had a chance to take a look at it yet because he got it in late on the day on Friday, but that'll be another way that we work with our food processors with regard to how they're taking steps to slow the virus here in our state. What is holding the government back from implementing regulatory directed health measures aimed at meat processing plants? What is the strategy behind leaving mitigation up to employer discretion instead of a statewide policy? Well, again, if you think, what's the old saying, that if you only have a hammer, you think everything looks like a nail? Our approach has been to work with people collaboratively. That's what we've taken the entire approach through this entire pandemic, to work with people collaboratively where we can to be able to get compliance. And if you look, for example, in Nebraska, it has slowed the spread of the virus here in our state. It has been effective. When we've gone, for example, the mayor of Omaha went to the big box stores, they were willing to be accommodative. That's happened all across the state when local officials have reached out to businesses. That's what we're doing here at the state as well. Reaching out to those meat packers, setting up these weekly calls, sharing best practices, and really working with them collaboratively to be able to slow the spread of virus. They have an interest in that too. They want to keep their plants open. We want to keep their plants open. That's how we supply the food chain here in our country. So it's important that we're working to protect the safety and health of their teammates, because if they don't do that, then their teammates are not going to show up at work. So this is a part of what we're doing, is to work collaboratively to be able to get all those, get that done. And again, we will continue to do that. Now, if there's something else we think we need to do because we're not getting the results we think we ought to be getting, then we'll take a look at those actions as well. But again, keep in mind, the whole goal of all this is to make sure we don't overwhelm the healthcare system. And if you look at places like Grand Island, we have been able to manage this in a way that has not overwhelmed the healthcare system.